Is marathon running good for the bones and how it affects the bones? Marathon running is definitely very good for the bones. It helps, first thing, prevent osteoporosis. So regular running helps in increasing the metabolism within the bone, helps in vitamin D metabolism, and most of the people who actually run marathons don't tend to have vitamin D deficiency. Another thing that running helps is to keep your knee healthy. Unlike the thought that people have thinking that marathon running causes destruction of the knees, it does not. Wearing a proper footwear is most important, and along with that, regular exercises, that is, which include quadricep strengthening exercises, calf strengthening exercises, and hip strengthening exercises. When we spend equal amount of time with these exercises as well as the same amount of time as running, it does not cause problem. In fact, it is beneficial to the knees. One of the most important things which marathoners must take care of is prevention and preventing stress fractures. This is one of the most common things that are seen amongst ultra marathoners, runners who run for long distances, and they do not understand that they have had a stress fracture. So it is important that whenever you have a little bit of pain or small issue within the bone, it must be looked into immediately by a specialist, and it must be investigated properly, which include MRI investigations, and understand why the pain is happening. So this will prevent any other injuries from occurring or prevent any other problems from occurring. To prevent stress fractures, again, very importantly, regular exercise is important so that the weight doesn't go on the bone and the weight is borne by the muscles, and hence the muscles prevent stress fractures from occurring. And hence, it is very good for marathoners to run. It is good for their bone health. In older age, 55 to 60 years, they in fact prevent them from having any bone issues, especially osteoporosis, which is more common in the older age group, as well as postmenopausal women.